Welcome folks to another video of ENT. I am Dr. Jawad Ahmad and today we will be covering the nasal septum perforation. The nasal septum perforation is actually a medical condition in which a hole or a fissure is formed in the nasal septum. Now you all know, and I hope you do know, the anatomy of the nasal septum. I have discussed in the previous video. If you look at it, this is the nasal cavity, which is the inside of your nose, and that is divided by this nasal septum into the right and left half. Now the nasal septum anatomy, as over here you have the columellar septum, then you have the membranous septum, and then you have the proper septum, or the septum proper. Now the septum proper is made up of the cartilage in front, that is the septal cartilage, and posteriorly by the ethmoid bone and the vomer bone. Moreover, there is a small contribution from the nasal crest. There is a rostrum of sphenoid, the crest from the palatine and the maxillary bone, and there is a spine, the inferior nasal spine. So these whole make up the nasal septum. Now if there is any perforation in this nasal septum, so that is called as the nasal septum perforation. The causes and that why it occurs are mainly the trauma. Say for example, some people are very aggressive in their nose picking, and they have always their finger inside of their nose, a dirty habit, and they are very aggressive, so they may cause damage to their septum and they may perforate it. Moreover, female love to wear ornament in the nasal septum, so they may cause the damage. There are some iatrogenic causes, say for example SMR, or during cauterization. During SMR operation, you know that you have to make the mucosal flaps, and then you have to take out the deviated portion of the septum. So in that cases, one of the complication is the nasal septal perforation. The next is the cauterization. So when there is epistaxis and you cauterize the blood vessels, so you may damage the septum as well, so that may cause this nasal septum perforation. Moreover, during nasal intubation, that's relatively rare, but still a cause of it. Moreover, some pathological causes, say for example abscesses. The Staph aureus love to cause the pharyngals and carbuncles near the nose, at the upper lip, near the upper lip and nose. So these abscesses may so those infection may enter inside the nose and may causes abscesses within the nasal septum, and those abscesses may lead to the necrosis and finally into the nasal septal perforation. Moreover, it is also sometimes associated with the chronic granulomatous conditions, very rare, but it is related with that. Say for example lupus, TB, or leprosy, or syphilis as well. The lupus, TB, and leprosy, they love to cause a granulomatous infection in the cartilaginous part, in this part, the septal cartilage part of the septum, whereas the syphilis affect the bony part over here. So the syphilis cause the infection over here. Moreover, some autoimmune diseases such as the Wagner granulomatosis. The Wagner is actually a disease, and it's an autoimmune disease, and this autoimmune disease, it mainly affects the kidneys and the respiratory system. And it may also cause the necrosis, the necrotic granulomatous inflammation, and that necrosis may lead to the septal perforation. Moreover, there may be invasion of the fly larva or eggs, and that is called as nasal myiasis. That may also cause the nasal septal perforation. Some drugs or chemicals, say for example chronic steroid use, they have an increased risk of the septal perforation. The cocaine addicts and certain occupations such as chromium plating, dichromate, or soda manufacturers, and exposure to arsenic. So those are also the causes. And if you can't find out the cause, so that's idiopathic. So that's also common. Let's talk about the symptoms and the clinical features. Actually, the symptoms depends on the size and location. So you may have small perforation or you may have large perforation, and where is it located? It is whether it's in the cartilaginous part or whether it's in the bony part. So they whole make up a very interesting story about it, and the clinical signs and symptom depends on that. So, and it may be asymptomatic. Say for example some people have the perforation very deep and they don't even know about them, so that's asymptomatic. And the closer the perforation is to the nostrils, the more likely is the symptom. That is very interesting to know, because if you look at the blood supply of the septum. So you see the anterior ethmoid artery, posterior ethmoid artery, sphenopalatine artery, the greater palatine artery, and the superior labial artery. So these are the arteries, and they form this plexus, the anastomosis, and this plexus in the anterior inferior portion of the septum. So that's called as Kieselbach's plexus, and this is the commonest site of the epistaxis. Now, if there is a perforation in this area, so you should know that there would be extreme bleeding, and that will there will be bleeding, there will be crust formation, and there will be all those severe symptoms. However, if it involves the bony portion, the posterior portion, so that's not that much symptomatic. So that's why I have stated that the symptom depends on the size and the location. So that's the location part, and how it depends on the size. If you have smaller size of if you have small size perforation, so what will happen, that it will produce a whistling sound. You know the whistling mechanism. You blow here from the air from there, it moves from over here as well, and then the incoming air, and that resonates. As a result, whistling sound is produced. Similarly, if you have small perforation, so that incoming air and the air through and through the perforation will produce the whistling sound. Moreover, if the perforation is large, so what happens, that there are more severe symptoms such as crusting and bloody discharge. So the air, when it passes through and through through the perforation, so what it does, that the margins of the perforation, so they are dried up, they ulcerate, and as a result crusting occurs, scab formation over those margins occurs. So there are very severe symptoms, and once you have the scabs formation and all that, so pretty bad smell come out of that as well. So those are all its symptoms. Moreover, if there are crust formations, now those crusts may also obstruct the nose, and once you have obstruction of the nose, so you can't breathe in air, and those obstruction symptoms will also come into place. Say for example, the air won't go into the olfactory area, and as a result you won't smell a thing. So that's also some symptoms. Moreover, the removal of the crust will cause profound bleeding, as you know. So the crusts are formed over there. If the crusts are formed by the drying of this area, and if you remove the crust, so what will happen, that the vessels on the inside, so they will bleed, and as a result you will have profound bleeding. So the clinical features you have to remember: small perforation will lead to the whistling sound, whereas large perforation will lead to scab formation, crusting, and bloody discharge. Now let's talk about the treatment a bit. So treatment is mainly, you first of all you have to find out the cause, that what is the cause of this septal perforation, because if it is caused due to some infection or abscess or some other stuff, or some systemic infection like the TB or lupus, so you have to treat accordingly, and you have to rule out those diseases, because they may cause the perforation again. Say for example, if it is Wagner, etc. Now the what you will do, that if there is a granuloma inside the septum, so you have to take the biopsy of that, or the free edges of the perforation, to figure out what is the exactly cause of this perforation. The small perforation, they can be closed by the plastic flaps, so the hole will never heal, the perforation will never heal, but it won't allow the air passage through it, and as a result those ulcerating margins, they will heal, and as a result you will alleviate the symptoms. Moreover, the larger perforations are difficult to close, and our aim is just to reduce the symptoms and avoid the crust formation. So alkaline nasal douches and the blend ointments are applied over the rough surface. So the rough surface are applied with that ointments and those douches, so as to keep them away from those crust formation, to avoid those crust formation, because those crust formation and those bleeding, those are actually very troublesome for the people. Moreover, septal buttons are worn to reduce symptom as well. So these will again alleviate the symptoms by not allowing the air to pass through. These are the septal buttons. So these are like Chinese stitch buttons. You have to open them up, then inside the nostrils, one through each nostril, and then over the area of the perforation you have to close them up, and as a result the area of the perforation, they will close up. So these are the treatment options, and if it is very severe symptoms, so you may go for the surgery as well. That will be all for now. Keep watching our videos and subscribe my channel for further upcoming videos on the ENT and various other medical stuff. Thank you.